Just up with the drone.
This is Cooper.
Finally caught my first ever Australian salmon.
And this is Dana.
I've been acting since I was 12.
When is your brother's wedding?
January. I draw, I do singing, I do scrapbooking. I also love pen paling as well.
They both live with chronic pain.
Everyone just sees it as something that happens to older people and it's dismissed a lot.
I'm in pain right now, but I'm not crying or saying ow. I build up a tolerance in the way that I can still function.
I just thought that one day it would wake up and get better, but no, it never went away.
It's just not talked about enough.
If something hurts for more than 3 months, or for longer than it should take to heal, that pain is chronic. It affects around 1 in 5 Aussie kids. And when they seek help, they can often feel like their pain is shrugged off by adults. Dr. Kelsey Dodds is a neurophysiologist at the University of Adelaide and an expert on chronic pain.
What someone perceives as being painful, another person might not. It's a very individual experience, and chronic pain can therefore obviously range from being relatively mild. People can still go about their daily tasks with the kind of dull, sort of achy pain, but then it can also scope to a really more severe pain where they can't get out of bed, and performing even daily tasks like having a shower is actually really quite difficult.
I was playing tag at school with my friends and I hit my knee. A few days later, I just woke up in screaming pain.
Cooper was 9 at the time and bounced between emergency rooms and GP clinics looking for answers.
They sort of, at the start, saw it as me just trying to get out of school. It was really hard to get anyone to pay attention to what was happening for me at all.
There is this general assumption, particularly in young people, that their pain is being made up because they want to get out of something, or they don't want to do something, or it's part of growing up.
At the time, we were living next to a lot of theme parks, so I couldn't go on roller coasters or anything. Just due to the vibration, like all these little things that you wouldn't think hurt, just, yeah, really hurt. You know, seeing all my friends around when I was still in school, being able to be a kid, and I wasn't able to do that. So it was quite hard mentally just to live, really, and yeah.
Cooper eventually found out he had chronic regional pain syndrome, or CRPS, a pretty rare condition that can happen after an injury or surgery. He also has a related nerve condition called allodynia.
Any touch, air movement, anything around my foot, which is where I have CRPS, it just causes extreme pain.
It took him 6 months to get that first diagnosis. But when it comes to chronic pain, that's actually kind of fast.
I was lucky I got it quick, but with a lot of people, if it isn't treated, it just gets worse.
Dr. Dodds says there are things happening inside the body that are hard to see or measure, which makes it hard to treat.
There's often a trial and error approach, so it's not simply going to the GP and getting a one quick fix and then being fine.
According to a new report from Chronic Pain Australia, that's Cooper on the front cover by the way, almost 2/3 of Aussie kids wait 3 years or more for a diagnosis, or don't get one at all. It also found girls made up nearly 60% of the kids impacted by chronic pain. Dr. Dodds says she often hears of young women with severe period pain not being taken seriously.
Medical professionals saying, well, pain is part of having periods. It's part of being a woman. That's something that you just need to get used to. But that's not the case. Significant period pain can be a symptom of endometriosis.
Knowing what's causing pain can help with treating it, but that doesn't mean it'll go away.
I have juvenile arthritis, which I have been struggling with since I was 3 years old. It is not osteoarthritis. I may have arthritis, but I am not old.
When Dana was still in school, she missed a lot of it. And when she could go, she says people didn't always understand the things she needed.
They would be like, why are you using the elevator? You don't look like you have something wrong with you.
With invisible illnesses, it's difficult for other people to accept and empathise if someone tells them that they're experiencing chronic pain. They simply can't see it, so they don't understand it.
It really affected my mental health, and just not being able to do what other people can do. I would watch all my peers be able to play sports when I couldn't do sports, and I'd want to join in. I'd want to go join them. I'd want to go hang out with them after school, but that's something I just physically couldn't do sometimes.
And the report shows that very often, chronic pain impacts things like a person's mental health, social life, education, and sleep.
I'm just tired, man. We're always feeling it in some way or another. Yes, we're good, but we're still dealing with something. At this moment in time, there is no cure for my condition. I can only slow it down.
Dr. Dodds says treatment is often more about managing the pain day to day, rather than completely stopping it. For Cooper, this means planning how to best use the energy he has, and pacing himself.
There's times where I'd go out with my friends and we weren't able to do quite as much.
He's 15 now and says he has better support than he had at the start.
We had one point where a doctor pulled up Google in front of us and Googled CRPS, which was not a great sign.
He's moved to homeschooling, travelling full-time with his family, and makes fishing videos.
In my opinion, bull sharks are one of the best eating fish you can catch out on these sand flats.
It's a real good distraction from the pain and is quite calming.
I'll measure this up.
Finding that thing that you can invest your time in and be happy while you're doing it. Just sort of get yourself out of those bad places.
Oh, yeah, baby.
Scene 3, shot 1D, take 3.
And for Dana, managing her pain means resting when she has a flare-up, and having an injection once a week to reduce inflammation.
I have a big needle phobia, so it's very hard to muster up the courage to do it sometimes.
She's pursuing acting, and also wrote a song about her pain.
Every day I feel so tired. This is not what I desired.
Other young adults and children, even if they don't have the same condition but suffer with an invisible disability, I hope it helps them.
We don't want Australian children to grow up and move throughout their life thinking that their pain is normal, it can't be treated, there's nothing you can do about it, and you have to just live with it. Everyone in the medical and scientific space, particularly in the pain field, they want to help. And there are scientific and medical breakthroughs that are happening every day.
Both Dana and Cooper want more people to understand their conditions, and want to see better support for all young people in pain.
If a kid was to go into the hospital and say to their doctor, hey, I'm in pain, it needs to be looked at as opposed to dismiss, which sort of comes through with funding and all that, where it just isn't seen and people aren't heard.
And if people don't understand or just don't like me because of my condition, okay, that's fine. Bye.